39 million people around the world are blind. That's 39 million people who are less likely to attend school, less likely to find employment, and less likely to engage in their communities. These daily struggles add up over time. Those who are blind in Africa are 4 times as likely to die. But most blindness is avoidable. In fact, 80% of blindness is preventable, which is hard to believe when you consider the fact that sight-restoring treatment for diseases like cataracts cost on average just $50. At Unite for Sight, we're tackling the problem of preventable blindness by working to improve eye health in the world's poorest communities. Our office is based in New Haven, Connecticut, but our impact is far-reaching. We partner with clinics in Tegucigalpa, Honduras, Accra, Kumasi, and Tamale in Ghana, and Denkanal, Chennai, and Patna in India. So how do we find and provide care for patients across the globe? It all starts with our local partners. We work with self-sustaining clinics run by highly qualified local ophthalmologists and optometrists. These clinics have long been providing eye care in their communities, but for years they simply didn't have the capacity to reach and treat the poorest patients in rural areas who otherwise could not access or afford quality care. That's where Unite for Sight comes in. We provide the financial and human resources that empower these clinics to eliminate barriers to care for the hardest to reach patients. Nearly every day, local clinic eye doctors and Unite for Sight volunteers pile into vans and drive for hours to reach patients in rural villages. They are greeted by hundreds of patients who have been encouraged to attend by the village's community eye health workers. The team begins with an educational health talk. What symptoms might indicate vision problems? What is the standard treatment for cataracts? They then provide eye exams for everyone in attendance. The local doctors prescribe glasses, administer medication, and coordinate surgery and other advanced care for those with more complex needs. But the story doesn't end there. The outreach team returns to that village each month to evaluate the outcome of each patient's treatment and to provide follow-up care if needed. This process is repeated over and over again so that over the course of a year, our partner eye clinics examine more than 200,000 patients and perform over 12,000 sight-restoring surgeries. That's thousands of children who can now pursue an education, parents who can now provide for their families, and citizens who can now become active contributors in their communities. So join us. Volunteer abroad through the Global Impact Corps. Fundraise for Unite for Sight's programs through your school's chapter. Take online global health courses through Global Health University, or attend our next Global Health and Innovation Conference at Yale. To learn more or to support our work, visit us at www.uniteforsight.org. We hope to see you soon.